Hi everyone, nice to see all of you. And we also have here Dr. Anjani, who will be our head guest. Sushman, if you can also spotlight Dr. Anjani, please. Thank you. So just to introduce myself, I'm Dr. Nikhil, and I am working with HealthifyMe as a resident physician. With me is Dr. Anjani, who is also a
Hi.
resident physician. I mean, she's so much more. She's a consultant working for us, and she's specifically focused in gynecology, but she has a wealth of knowledge to share with us today. And so today we're going to be talking about how to take medication safely. We know that during the COVID pandemic, it's been so much more difficult to get to a hospital, so much more difficult to meet your doctors and to get good medical advice, especially when you're confined at home. So, to make it a little bit easier to make those kinds of decisions that all of us make every single day, we've got Dr. Anjani here to speak with you. Dr. Anjani, would you like to just take a moment to introduce yourself and anything else that you want to add?
Yeah, thank you, Nikhil. Thank you for the nice introduction. So, basically, I'm an infertility specialist, and I'm with Healthify Me for last 2 years. And so, as of now, currently, I am just now completed my fellowship. So, and I'm a mom, so busy with home and taking care of the baby. So,
One of the busiest jobs, I think, as if you didn't
yeah,
already have to.
yeah.
But just to start off, Dr. Anjani, so I think today we're talking about self-medication practices and how we take care of ourselves. Do you have any particular experiences with incorrect self-medication practices? Maybe both as a before becoming a doctor, but also with like people who are doctors?
Ah, so basically, this is the paradox that those who are, medical students, nursing students, pharmacists, and full-fledged practicing doctors, they have a very common tendency to, uh, take medicine on their own without seeking proper consultation. See, suppose if I am having, for example, I'm having headache for continuously for 2 weeks.
Hmm.
So it's not a good idea for me to keep taking paracetamol. Even I should get my, eye checkup done, blood pressure measured. These kind of basic things every one of us need. So when doctors, medical students, when they are, mismanaging themselves, then what to say about the normal person, non-medical person? So it's a
Yeah.
very common practice.
And I think doctors are some of the people who do it the most also, right?
Yes, because it's easy for them to get all the prescriptions and all. No? They have, they can just simply write and get it signed by their colleague or something. So
Yeah, yeah. And it's very common for us to sometimes get it done very often. So I think one story that I remember very, memorably from my time as a student was one of my senior doctors was, I was working in a rural center, and one of my senior doctors who had been a doctor for 2 years studying as as a postgraduate to become a community health physician. So we were running this center which had some pharmaceutical medication easily available for emergency reasons, and she had a severe headache at 2 in the morning. And the first thing she did was take a paracetamol, which she had kept next to her bedroom. But she was not able to fall asleep. So within 10 minutes, she was having another paracetamol. Then she was still not getting a clearance in the headache because we know paracetamol takes half an hour to work. But she immediately went and took one more medicine to go with that, which was like an ibuprofen, and then Brufen, for people who don't know that. So Brufen she had on top of that. Then 5 minutes later, the headache was still not gone because it takes time. And so she went and took a tramadol on top of that. And so she had taken 4 painkillers in like what, half an hour. And finally, the first medicine started to work because it takes time after you take the tablet for it to go to your
yeah,
stomach and start working. So that was the time I realized that if you are a doctor, but you are in pain and you are worried and you're not able to sleep, nobody can make a clear decision. And sometimes even we need to be reminded that what is the best way to take our medicines and how to be taking the medicines the right way. So just a funny story to begin that conversation, Dr. Anjani. Have you seen any time any really big serious errors that a patient has come to you because they've taken medicine the wrong way and they're coming to you in a very bad situation. Have you ever felt really sad when you see something like that?
See, one of the very common things I'll tell you, which is very serious also. So I'll not. So basically, it's a patient was there. He's around 65-year-old man, and he basically had heartburn, right? So this is the history given by the patient, and they finally landed up in the emergency room.
Okay.
He was having heartburn for some time, so they keep on taking that cocktail of pantoprazole, ranitidine.
So you're feeling like some acidity type feelings.
Diagene. So basically, it was heartburn. So he is having something like just so some family physician was there in their family, homeopathy person, somebody who said ki heartburn is like, it could be acidity. You keep on taking this. Some homeopathy medicine also they have taken.
Okay.
Then it was not relieved. Then he started feeling giddy and all. So finally, somebody said that no, you should go to emergency room. It's not a good idea. You are aged also. So there was no family history, nothing of any heart illness or something. He is not having any BP, no cholesterol, nothing. He was perfectly healthy person. Now, when they landed up in emergency room, now you are having heartburn, we'll do one ECG. We'll do one chest X-ray. Okay, so we did that. There was ECG changes. So we told the family, the son, that so and so changes are there. You need to get him admitted and all. Now it came as a shock. It's like aise kaise ho gaya and all that. So finally he got admitted. It came out to be some D2 changes were there. Mild,
like having an actual heart attack.
Mild infarction was there. Angioplasty was planned, and now finally after angioplasty some blockage was found, and then it was treated. It was
like
removed.
A full surgical procedure to help his heart
Yes.
attack. Like angioplasty is still like they put something inside the body.
Yeah, they put the dye, they see the blockage. Now, if the blockage is, you remove it. So it was dealt in a timely manner because thankfully they came in the emergency room. Suppose they keep on taking that medicine, what would have happened?
Exactly.
So basically, these kind of ailments come suddenly, especially in heart-related, brain-related, and lung-related. Tripod of life we used to study in forensic medicine. Dr. Nikhil, you must have remembered tripod of life. Heart, brain, and lung. So you have to take care of that.
Yeah.
If a symptom is not getting, so it's good to be it's good to be aware of your health, but you should know that when you have to actually visit the doctor.
Absolutely. I think that's the fundamental question, right? Like, at what time is it serious enough that I should go to a hospital or show a doctor? And when is it okay that I can just take care of it at home?
Yeah.
And I think many times we go to somebody who is in our family. I think we had discussed this earlier, where somebody in our family or friend circle, there is somebody who we can trust. And these are not always doctoral candidates. So they will often say something that is really not the right thing, but sometimes they give good advice. But if they say the wrong thing, then it really does affect our health as well, right? Especially if they have no medical training, but they give some sort of answers. But going into that a little bit more, I think where we saw this really get messed up was during this last 2 years of COVID pandemic, right? And that's also going on right now, where so many myths about what you should take and what you can't take have caused so much harm to so many people. Right? So many people have the misunderstanding of what to do when they have COVID. And even some doctors have been misled by some of these early scientific discoveries that were not later proven to be not true. Right?
Yes.
Maybe you want to talk about that a little bit, Dr. Anjani. Have you seen any issues like this or heard about any severe?
Yes. So basically in the COVID era, when the first wave of COVID started, there was a lot of fear. So fear was more as compared to actual symptoms because recovery was more. One means mortality was there, but if you're a healthy person and you have no comorbidities and such population, that percentage of people are definitely more, then you will recover sooner or later. Maybe some trailing symptoms will be there, but by 3 to 6 months of time, you will recover completely. Now, when you visit a doctor, there is a tendency, डॉक्टर साहब ने तो कोई दवाई नहीं लिखी, कैसे डॉक्टर साहब है, right? So, and there was a sort of panic among researchers also that we need to have some medicine that can have some effect on the virus, if not on the virus, then on our system, so that we are able to fight the disease in a better way. So these kind of studies were getting conducted, but it was not evidence proved. So there is something called as evidence-based medicine. So doxycycline, ivermectin, what not. I mean, every kind of medicine, hydroxychloroquine and dexamethasone, prednisolone. That no, there was a long list of prescription, given to the COVID patients. It was doing more harm than good because none of the fact is proven. It is still not proven. And then you are taking all these medicine for a long period. People kept on taking multivitamin for whole year. So so all these practices should be stopped. You should be knowing, you should be aware that. So here the role of the doctor is very important. That you should be well aware, you should be well informed about the current practices which are evidence based, and you should properly educate the patient, especially the person who is a health influencer in the family. That all this you have to follow and all this you don't have to follow. So if a patient know do's and don'ts, it has a given set of guidelines. Okay, ye fayda karta hai, ye fayda nahi karta hai, it will have a remarkable effect.
Yeah, I think what you're saying, Dr. Anjani, which is really important, is that COVID is not that dangerous, right?
Yeah.
At least especially now, and in the first wave also, we were seeing that it was not causing as much death, is what you had said, mortality. It's not causing as much death to people who were relatively healthy, who were not too old, who didn't have too many other, problems in their health. They were doing relatively fine. But still the fear and the anxiety, and even doctors, right? Because as a doctor, if somebody comes to us and says, I've got COVID, if we don't do everything in our power to take care of them and something bad happens, right? If they go to an ICU because we didn't give one medicine that could have saved it. So we were also, I think, prescribing multivitamins, this, that, drink 3 to 6 liters of water per day, and eat certain kinds of food. And there were so many myths. I think one of the scariest myths I've heard, though, was, I think it happened in Iraq, where they drank methanol some soothsayer, some quack basically had informed everyone that methanol was the way to go. Even in the USA, there was one president who even said that you should drink disinfectant or something like that. So
oh my God,
really crazy ideas had started to come about, and even the whole countries were doing things that were in the wrong direction because of the panic that COVID was creating. But I think now we've started to understand, especially with this Omicron variant of COVID, right? It's very similar to other virus strains in the sense that it causes a lot of the very similar symptoms, and the danger levels are very similar to influenza, which is a very common virus which causes like cold, cough, this, that. What do you think the current standard treatment for a COVID variant is if it's not serious, right? We're sort of seeing it as a home-based care. You're not coming to the hospital, you're okay to stay at home. What should a person do if they have COVID or they have COVID-like symptoms? They may test negative, but they still have to take care of it like it is COVID. What should a person do in these kind of situations?
There are 2 to 3 things we have to understand. In India, people have hybrid immunity. Hybrid immunity means there are no restrictions were followed. All that election rallies are going on. People are not fully vaccinated. Vaccination rate is still not at par because of the population of India, and most of the population is in the rural setting. So because of the hybrid immunity, it is a good thing in a way that whenever the virus, even a new variant will come, because of the hybrid immunity, we will be able to deal with it together as a populace.
Okay.
Second thing is, as the mutation will keep on happening and new variants will keep on coming. So COVID is here to stay. So we have to make a mental makeup that this COVID thing will happen because our immunity is boosting up. So the virus is also boosting its own genetic material, and it is going to mutate so as to survive. As we are surviving, it will also make its effort to survive. So it will be there. But the good thing is, because of the immunity, the effect of the virus will not be to that extent. It will not bring that much mortality and morbidity. So we will be able to deal with it in a better way if we will follow proper precautions. Now, why we have to follow precautions? Because people will ask, if it is not so serious, if it is not so symptomatic.
Okay, Sushman, have we lost Dr. Anjani as probably an internet issue?
Yes, doctor, I'll check with her.
Yes, please do that. Meanwhile, everyone, I'm so sorry for the technical difficulties. But I think what Dr. Anjani was saying was that in the initial part of the pandemic, we were seeing a lot of these like really bad strains, right? And the first COVID pandemic, we were really scared. And there was a lot of death, there was a lot of concern. But as we sort of, especially India, like we went through like a very serious lockdown, right? Many other countries were looking at us. WHO was pointing us out as a very great example of how to take severe restrictions against COVID to protect our people. Now, those restrictions turned out to be taking, like we kept it for a very long duration of time, but COVID didn't go away. And we realized that that level of restriction was just not allowing us to function. We could not maintain this for very long. Just 1 second, everyone. Sushmin, if you could just pause it. I heard. Yeah, so sorry, Anjani is just joining back. I'm so sorry, everyone. But she just called to inform me that she's coming in a minute. So when this pandemic was really bad, we were always trying to fight it. But now we've understood that some restrictions are necessary, but we don't have to go overboard like how we went in the first and second waves, right? Especially with the Omicron variant, which is a much milder virus. So what we can do is what we would do with any viral treatment, right? Viruses and bacteria are different. Like TB, typhoid, these are some bacterial infections that have caused a lot of harm in our country. Okay, viruses are more like HIV, right? You cannot use azithromycin to treat HIV. You cannot use amoxicillin, like penicillin to treat HIV. There is something that works here, there is something that works there. You can't mix and match however you want. Okay, so a lot of the medicines like doxycycline, like azithromycin, they work really well on bacteria. But in terms of viruses, they really have next to zero impact. Unless a virus after coming in, a bacteria is coming on top of that, it is not at all helpful to take antibiotics for this kind of thing. So as we've started to learn that this virus is not so severe, we've also scaled down the kinds of medication that we use, and as doctors as well. And so we no longer use antibiotics. Now, in some cases, when we looked at the treatment of COVID, vitamin D supplementation was one of the only vitamins that we found was really effective. And that could also be because it does help our immune system. And a lot of Indians are very vitamin D deficient. And why is that? Very easy to answer. Vitamin D is better when there is sunlight, and Indians don't like going out in the sunlight. And with COVID, we don't like it even more because the sun is always hot in India. Abroad and all, they're just like, oh, it is sunny today, let us go outside. When we are saying it is sunny today, we're like, we'll stay inside, right? So we avoid the sun. So therefore, there's a lot more vitamin D deficiency. And with COVID pandemic and all the restrictions, most of us are staying at home most of the time and working from home, eating from home. We don't go out much except maybe late in the evening after work is over, right? And so a lot of us are vitamin D deficient. And so it makes a lot of sense. And Dr. Anjani is back. I was just going to finish and say that vitamin D supplementation was the only thing that was found to be useful for COVID. Dr. Anjani, I'm sorry, I was just holding the thread on what you were saying. Sorry, we're not able to hear you. I think you're on mute still.
Yeah, is it okay now?
Now we can hear you. Yes, thank you for joining back. So sorry about the technical difficulties.
Sorry.
I'm sure everyone here is familiar with that issue, but please continue, ma'am. I was just telling that antibiotics work on bacteria, but not on viruses. And so we cannot use azithromycin, amoxicillin for the COVID virus. And I mentioned that vitamin D supplementation was the only treatment that was found to be useful for COVID. I hope I'm still right on these things.
Correct. Yes, absolutely, Dr. Mikkel.
Okay. Anything else that you would be recommending for somebody who maybe is experiencing COVID at this time?
So that depends, first of all, on the severity. So first of all, you have to, if you should have one pulse oximeter at home. Right. If your pulse, so you have to keep on monitoring the saturation level, and you should be aware of your seriousness of the symptoms. So it's not just your respiratory system will be affected. Your GI system, means your tummy, can also be affected. You can have nausea, diarrhea, like that. You can have fever, and you can also have your heart, cardiovascular system affected. You can also have your nervous system affected. Means you can experience palpitation, lethargy, weakness. You can experience dizziness, giddiness because of cardiovascular and neurological system affection. So if these kind of things are happening, it's a good idea to get yourself examined by a registered medical practitioner, not any doctor. So
So
there are
if I
many
was to
doctors.
just summarize that, Dr. Anjani, you're saying that if I was to feel my heart beating, feel a little bit dizzy, if I was having
Yes.
very severe diarrhea or cough or cold, very
Yeah.
severe fever, that even after taking paracetamol,
Hmm.
650 milligrams or 750 milligrams, I'm still having a fever post the tablet. Not like 6 hours later when the tablet effect is gone, but if I'm still having fever after taking the tablet, any of these signs, I should probably go to a hospital, right?
Yeah. So, sorry. If mild to moderate symptoms can easily be managed at home, even in the guidelines we mentioned, there are three grades of severity: mild, moderate, and severe. So, on the basis of also, it's one category is the symptoms, mild symptoms. You can easily manage. You are able to do your day-to-day life. This is mild symptom. On your pulse ox, your saturation is well above 94%. This is great. You can easily manage at home. You don't have to visit a doctor. You can, if you want, you can have teleconsultations and all, but you don't have to expose yourself, go to the hospital and expose others and expose yourself as well, because our immunity is a bit compromised when we are symptomatic. Then is moderate degree. Moderate degree is when your symptoms are severity is higher than mild. Subjective. This is subjective. And on pulse oximeter, it is less than 94, but it is above 92. So between 90 to 94, it is moderate degree. There is saturation in pulse oximeter. Now here you can manage at home. You can also visit the clinician. It's a discretion depending upon how much affection you have. If you really feel palpitation, if you really feel lethargy and all, you're sweating too much, you feel giddy, diarrhea, and all these kind of symptoms are there. It's a good idea to visit the clinician. Severe degree is when pulse oximeter is showing continuously below 92%. Even on deep breathing, on room air, it is still below 92%, and your symptom severity is symptoms are in a severe category. Means you have to visit the clinician. Don't keep on sitting at home.
Right. I think there's one thing that I would want to ask, because sometimes you see, when my mother had COVID and we got the pulse oximeter for her, and sometimes we were seeing that when we put the pulse oximeter on, sometimes it would say 65% for like a minute or two, and then later it will come back to 95. And after checking it a little bit, I was finding that it's like when the waves are not correct, then the number can go off a bit. But once the wave is correctly coming up and down, then it was a little bit more reliable. What is this issue? Is there something sometimes that the pulse oximeter can give wrong readings if you're not?
No, so basically we have to check our index finger when we are putting it. It should be clean and dry. So sometimes some things are sticking, it's sweaty. So then it will give a faulty reading. Then you have to check your pulse ox as well. It is, working accurately. So if you put it again, you can put it on some other finger as well. If it is more or less, if it is giving correct reading, then it is a reliable machine.
Okay. And so basically you said about the symptoms and the pulse oximeter, we can use that to sort of get an idea about how severe our situation is. But we're also seeing that the situation is not as severe as it used to be. Like my sister recently got COVID, tested positive and has now tested negative, thank God. But while she was positive, I had gone to stay with her and like make sure that she was okay, because there was no maid or cook that we were allowing to come into the house that time. And so I was cooking, cleaning, all that, and taking care of her. And she was very tired. She was always lying in bed. Her fever was still high, at least for the first 3 days. Very difficult to come out and get food. She came out and tried saying, hey, you haven't swept the house properly, and tried to, make sure I was doing a good job and like sleep over there. And she tried to do some herself. And then she got very tired, sat down. And I was like, dude, okay, I have not done the job. I'll do it now, but like go and lie down. But the fact is that she was feeling very tired. That was a big symptom for her. And I think we're still seeing a lot of these symptoms and post-COVID symptoms, right? Where a person has a lot more tiredness, a lot more fatigue, a lot more brain fogginess or difficulty concentrating at work and at school.
Yes, Dr. Nikhil. So basically, tiredness could be, first of all, which is most common, underlying any deficiencies. Like if your hemoglobin was on a lower side, you have 90% of the population is vitamin D deficiency in India. if you have vitamin B12 deficiency. So that can exacerbate the problem. As soon as, virus infection happens, especially COVID, which has a tendency to, persist the symptoms have a tendency to persist for quite some time, then definitely you will feel tired. Apart from that, because of the illness itself, once when fever happens and when it goes down, you definitely feel tired.
Yeah.
So because of all these things, tiredness happens and it persists also. It's a good idea, to have every 6 to 8 months, get your routine blood checkup done. And if there are any deficiencies, to get it corrected.
So if I understand right, it's good to treat for any vitamin D deficiency. You can even supplement, I think, even without testing sometimes, because so many of us are deficient.
Yes.
Right?
So here comes the question: self-medication. So very good way to bring it there, Dr. Nikhil. So the thing is, if you are going to take multivitamin just like that, every 2 months you are going to take, multivitamin. This is very common, even on HealthifyMe patients say कि डॉक्टर साहब हम ना मल्टीविटामिन थोड़ा थोड़ा बीच बीच में खा लेते हैं फिर बंद कर लेते हैं फिर थोड़ा सा खा लेते हैं फिर बंद कर लेते हैं it's not a good idea because it will if suppose your body is well nourished you don't have any deficiency you have optimum amount of vitamin B12 vitamin D everything is there and you keep on eating what will body do I mean if you're taking excess amount of certain things body excrete very easily like iron if you take more than enough iron it will not be absorbed it will simply pass out in the stools it will be still in your intestine it will pass out but for vitamin D for vitamin B12 especially vitamin D it's a fat soluble vitamin whatever you will take it will absorb and whenever it will be in your blood and whenever it will measure you can it's not that common to find it because people are already vitamin D deficient but like for example my mother-in-law she keeps on taking vitamin D now and then so when we got her tested this time on a routine health checkup vitamin D levels were way above 1000 which is not good right anything excess in the body and anything deficient in the body is not good so you have to get yourself checked the good idea will be to deal it's your body right so you have to deal with it in a proper manner get yourself checked if the levels are deficient there is a depending upon the level of deficiency there is a proper course take multivitamin for 2 to 3 months depending upon the deficiency then you have to stop again after 6 to 8 months you will get your blood test repeated so again you will find out whether you are what are the levels and accordingly the treatment will be done it is still a medication it is not कि हम ज़्यादा multivitamin ले लेंगे तो हमारी health कुछ extra better हो जाए it's not like that
agreed I think in general, having B complex vitamins and vitamin C do get washed out and we don't need to be too concerned about having too much of it. But there are also some concerns about the quality of those medications, right? The multivitamins are sometimes showing side effects as well, not from the vitamins themselves, but from the way that they are mass producing these substances. But in a more larger scope, I just want to talk about vitamin D. So you're saying that it's okay to supplement it if I've done a blood test beforehand and I'm found to be deficient. It's okay to take vitamin D post that and then check that I have reached where I need to reach and then I can stop it. Is that correct?
Yeah, so I generally don't advise them to recheck it once you have completed the course because there are two reasons. One is vitamin D levels will be replenished if you have taken the course properly. Number two, it is a very expensive test. Vitamin D test is pretty expensive. So you don't have to check it. It will be fine.
Okay, so you don't need to check it again. So just once in the beginning. So if you're getting COVID or anything, you're getting some regular blood test to check that you're okay. You can do vitamin D with that, and then with that you can add your you can do you can have medication if you're deficient. Otherwise, don't simply medicate on vitamin D. Other vitamins, I think, is a little bit more flexible, but vitamin D is one where you really need to be careful of not taking too much. Am I right?
Yes, correct.
Okay.
And another reason is that there is so much advertisement going on of multivitamin brands, so many, this Livogen and Liv 52, these kind of, advertisement keep on coming, Ojiva and all these. So don't get influenced by that. You have to do everything in a correct way.
Okay. And I think otherwise in terms of COVID, is there any nutrition or physical activity or anything else that you would advise, Dr. Anjani, for a person trying to stay at home and eat healthy during COVID? Is there anything that you would mention specifically?
Anything specific means you have to have a healthy diet. You have to have a healthy balanced diet and you should keep on having, physical activity if you are staying at home. because if you will keep on lying down, if you will be sedentary, then even the lung capacity gets affected. So it's a good idea, do some stretches, as much physical activity as it makes you comfortable. And
Right.
once you are recovering in a graded way, you can increase your physical activity.
Right. So for the first 2-3 days of your fever, you can just sort of lie down and relax, but do get up, go to the bathroom, get your steps.
Breathing exercises, yoga, postures, all that you can do.
Just like do a few stretches that you can do from the bed. And
Correct.
after you've recovered 2-3 days, then to slowly increase it. But I don't think you should be working out in a gym like way until you've taken at least 2 weeks from the virus, right? Just so that your body had enough time to adjust.
Correct.
Okay. So I just wanted to make that clear. Finally, Dr. Anjani, because so many of our people are actually trying to work out with their fitness experts, and if they get COVID in this like COVID heavy time, they do want to take a break and inform their fitness expert that they're going to take a little bit of a break and come back. But finally, I think I want to open it up to more than just COVID, because there are so many users dealing with so many other issues. So Sushmin, if you could just open the chat, and if you can just put your questions down on the chat, me and Dr. Anjani will go through it, and we'll try to give you a little bit more context of when it's okay to do some things and when it's not okay to do some things, right? So if you can open the chat, Sushmin, we would be happy to start. And before we do that, Dr. Anjani, I think you and I were discussing about a few very common ones, which was like antibiotics. Can you give me a little bit of context with like nose and throat infections and antibiotics? Where do I err on this thing? Like, should I take it? Should I not? Like my girlfriend has recently got, fiance actually.
Congratulations.
Thank you. Very recent, yeah. So she's had a little bit of a throat infection. I was in that question of, do I give her antibiotics? How do I make this decision?
Yeah. So generally, it's a two-edged sword. Even for us, it is difficult to decide. The thing is that symptoms are more or less same, even if you're a viral infection or a bacterial infection. So you wait for 3 days, depending upon the level of severity you have. If you are really, if you're having high-grade fever and all, then it's a good idea to start antibiotic. But if it's only cough and cold, some sore throat like that, you can wait for 2 to 3 days. You can have, warm saline gargle, betadine gargle, steam inhalations like that, and you can wait. But suppose on the second, third day itself, fever started happening, then it will be a good idea to start antibiotic. You can take azithromycin. It's a 3-day course, 500 mg, 1 tab daily, or you can take amoxiclav, 625 mg, 2 times daily for 5 days. Along with that, you should take one pantoprazole to reduce acidity and one probiotic once a day, so that you don't have any loose motions with amoxiclav, because it causes loose motion. So the idea is that if you have any infection, means your immunity is breached, means you have high tendency to develop bacterial infection as well. So if you take an antibiotic, there are two things. First of all, if you can manage for 3 days, if you have mild symptoms, don't take it. If you have moderate to severe symptoms like fever and all, then you should take it. And second thing, most important, if you start antibiotic, please complete the course. Because if you will not complete the course, then the antibiotic will be develop resistance in your body. Means the virus or bacteria, whatsoever it's there, if you have not completed the course, it is not able to kill the virus or bacteria, whatever it is. The pathogen is not killed. So it will slowly, alter its genetic material, and next time, or maybe after sixth or seventh or nth time you will have the infection, that particular antibiotic may not be effective. So that's the idea. Important is whenever you start, you complete, means kill it completely, so that resistance do not happen. And nowadays, in today's era, because of the abuse of antibiotic, people are taking, then leaving as soon as they become asymptomatic, they straight away leave it in between. So the pathogen is not killed, although you are symptom free. So it developed resistance. And now a new variety of bacteria and viruses is coming that we call superbugs. So superbugs means today's antibiotics are no more effective. One very common example, I don't know if you've heard of it, like penicillin, which was a miracle, used to call as a miracle drug for bacterial infection, is no more effective now, except from syphilis. We give it in syphilis. Apart from that, it is not effective anymore. Why? Right. Because of the resistance that it has. It can happen. So
just to clarify on a very strong way about this, Dr. Anjani, if I understand what you're saying right, if I have a bacteria in my throat and I'm taking an antibiotic twice or thrice, but I don't take it for the full prescribed course, right? When you're taking an antibiotic, there's always like a 5-day or 7-day course, maybe 2 to 3 times a day, that it's given, right? It's in the textbooks. It's like, this is how it's supposed to be taken, right? If I don't take it like that, there's a serious chance that if I take it for 2 days and stop, on the 4th or 5th day, my bacteria will come back and the medicine that I was using will no longer be effective. Is that what you're trying to say?
No, it may not come back. Your symptoms may not come back. You may be recovered in 2 days dose, but next time the pathogen is not killed. Some amount of bacteria is always there. Although our body is able to deal with it now because the load, the bacterial load has reduced considerably. Now our body can manage, but it is not killed by the antibiotic. So whatever little bacteria is still there, it can mutate, it can alter itself, and it will have resistance. So next time, it will
come back stronger.
Yeah, it will come back stronger, and the antibiotic will not be that effective.
Antibiotic won't work. All right. I think I've kindly been able to. I just want to make sure that everyone.
This is called as antibiotic resistance. Means and it is on an individual basis. So one individual developed resistance, then suppose that individual is infective from the nth time. Okay, right. Now that bacteria or virus is transmitted from him or her to other person. Now that resistant bacteria or pathogen is going to have the same resistance will be in the other person as well, and this is how it's spread. This is how this antibiotic resistance is spreading.
Right. Okay, Dr. Anjani, we're getting a lot of questions, and I really want to take some time to answer the questions that are coming up. I'm just going to go through the questions, and I think you can just answer them. So one of the questions that came up is there a particular brand that we would suggest for vitamin D supplementation?
There are many
that you regularly prescribe.
I see the drug name is cholecalciferol. It comes by different names. So 60,000 unit cholecalciferol you have to take. It comes with Uprise D3 is there. There are many brands in the market.
Okay. One of the brands I remember most easily is D-Rise.
Uprise.
It's a very funny drug, which is why I can never forget that name. But I think what you're saying is that any brand
Uprise
that contains this D3, Uprise
D3 is good.
So D3, which is 60,000 international units. If people just remember 60,000 IU, okay, that has to be on the box. If it's less than that, you're not getting a good dose. And if I remember right, Dr. Anjani, it's once a week.
Yeah, it's once a week. So depending upon, so the vitamin D deficiency has 4 levels: deficiency, insufficiency, adequate, and higher levels, toxic levels. So if you are in a deficient state, you have to take it for 12 weeks. If you are in an insufficient state, so your lab, whatever report you will get in the lab report, they will mention the number from this number to this number. It is insufficient. Below this number, it is deficient. From this number to this number, it is normal. Above this number, it is toxic level. So if it is in the deficient range, means generally it is less than 20 nanogram per ml. That will show the number it will be showing. So then you have to take the course for 12 weeks, means total 12 capsules or sachet you have to take. If it is insufficient, then you have to take it for 10 weeks, 8 to 10 weeks. And if it is normal, then normal. If it is toxic, then obviously you are mismanaging yourself.
You're taking way too much, right?
Yeah.
So one more question so that I hope answers Karthik's question, but a question from Rashmi Tangsali is, if I'm taking precautions like self-isolation, and there's often a lot of stress at this time, there can be some acidity and gas formation. Is there anything that they can take to avoid this, both nutritionally and also like in a tablet way, so that they have
acidity? Generally, first of all, for bloating, means for gas formation, you can increase your physical activity. You can just walk around a bit and take fiber-rich diet, so that you are passing stools properly and there is less gas formation. In fact, even 2 weeks before periods also, generally women tend to feel this bloating and acidity. If it is that period of time, definitely conservative management should happen. Don't go for any medicines a lot. But suppose it is not helping, then you can go for Diagene Gelusil. You can take pantoprazole tablet once a day in the morning, empty stomach, or twice a day, empty stomach. And if still it is not helping, one Medigas tablet is there. Medigas for gas formation on an SOS basis. Don't take it more than 3 in a day. So you can take it on an SOS basis if there is too much gas, too much blood.
Okay. So I'm going to answer one question, Dr. Ashmi, which is that a lot of people are asking about vitamin D and what is the level of insufficiency and what is like at what point should they consider that they should take the supplementation and what point do they not need it? And like a basic answer, everyone, is that 30. 30 is that number. If you're lower than 30, generally speaking, you need to take supplementation.
So Dr. Nikhil, there is a unit. There are two units, nanomole per liter and nanogram per ml. Numbers are different for both of them. Nanogram per ml, it is less than 20. Nanomole per liter, I don't remember.
Okay, let's just go with nanograms per ml because I think that's pretty clear. What is the number, ma'am?
Less than 20. So important thing is in your report, they will always mention the levels. There will be a unit and they will mention your value as well. So depending upon that, you can see in the report whether it is deficient or insufficient. Right. If it is depending upon the level, you can decide.
Okay. So that is one question, ma'am. There's another question from someone, Rashmi Singh, who has asked a few questions which I think are pretty relevant. The first one is the current COVID airborne? Yes. What are the symptoms of the current COVID variant? And is that variant affecting kids and infants? If it is it severe? And should we start medication as a precaution for these kinds of use? So,
Rashmi, see, yes, COVID is airborne. That's why we should wear mask, if possible, double mask. Second question was, can our kids affected? Yes, kids are in fact, a child less than 2 years comes in a high risk category because his or her immunization is not complete and still dependent on intrinsic immunity. So less than 2 years, they're definitely at high risk. After that, immunity has built up because of the immunization schedule. So it's still okay. What was the third question, Dr. Nikhil?
The third question is, are there any differences in the current symptoms of the current COVID variant, which is the Omicron variant? Is there any difference in those symptoms and what should we expect? What kind of symptoms are we expecting here?
See, the thing is, in general, depending upon, there is no such clear distinction between Omicron variant, Delta variant, and other variant. It's just that any organ system of your body can get affected. Even the cardiovascular, as earlier in the talk we have discussed, Dr. Nikhil, even the apart from respiratory, cardiovascular system, neurological system, GI system, anything could be affected. You can have diarrhea, you can have giddiness, lethargy, you can have palpitations. So if symptom severity is affecting your day-to-day life, it's a good idea to get yourself checked by the doctor.
Okay. So Dr. Anjani, there's Aparna Paul who has come with a very specific question, which is that when she had some symptoms that were symbolic of COVID, she was initially prescribed azithromycin for 4 days. And after those 4 days, she was given Molnupiravir, which is the brand name for a drug called
Molnupiravir. Yes. Nowadays, it is being sanctioned for use in COVID patients. So that depends upon your
clinical condition, right? And what the doctor thinks is the issue and whether it's correct. What do you think about azithromycin being given though?
Azithromycin. So basically they must have respiratory tract infection. So generally we start antibiotics so that if it is first of all, if it is a bacterial infection, then it will get corrected, or because of the virus infection, there could not be secondary bacterial infection. Means your immunity is compromised. Then now another bacteria should not come and invade you. So we start azithromycin. That must be the reason.
Okay, so I just want to make that clear. So generally speaking, this azithromycin is not to treat the COVID, but it's to prevent any worsening by some bacteria that is around, taking advantage of the COVID situation and multiplying there. But in terms of the treatment for COVID, it's not that COVID is going to reduce very quickly because of azithromycin. I just want to make that clear.
Yes.
And of course, anyway, moving on, ma'am, we have another question, which is about the post-COVID symptoms. So they're talking about, this is from Vandana, who's saying that COVID happened a year ago. She started developing back pain during that time, but that back pain is still persisting.
Okay. What's the age? And Vandana, what is your age? So basically I'll answer in a holistic way.
Sure.
See, thing is that low back ache is a very common complaint of women, and most common cause apart from vitamin D deficiency is bad posture. If you are not maintaining your posture properly, so good posture is when you are sitting, you sit straight and your entire weight goes to your buttocks, not on or in the on the middle of your buttocks, not on anywhere in the spine. So if your spine is bent like this, bent like that, like some people when they sleep with their in a prone position. They lie on their back. And in women, what happens is after childbearing and all, because of the vitamin D and calcium deficiency, our back tilts like this in the low back area. And there is a very common reason for having low back. Generally, your back should be straight. But when you're lying on your back in a prone position, you're sleeping whole night, it will be lordotic. This is called as lordosis. So that is not a good thing. So if you are able to manage your posture, if you are well supplemented with vitamin D and calcium, it takes care of it. Apart from that, if you still have low backache, then you should get yourself.
Okay, I seem to have read a.
Yes.
I think I discovered the reason, Dr. Anjani, because I read a later message by Vandana, and it says that she had a kidney transplant a couple of years before. And I think that could be really the reason, right? Because the kidney is at the back of your body. And so a lot of the pain from a kidney does show up at the back, right?
There's so many questions, Dr. Nikhil.
Yeah, I know. We've got way too many, and we've got I think I'm going to give 5 minutes to answer the questions. Do you want to answer any specific questions here?
I cannot. There's so many questions. You please take the lead.
I'll choose them. I'll pick them out. And I hope everyone who I don't pick just forgives me for this. So here's a question about from Karthik, which is about the vitamin D. So they know that they need to take it, but how do I know at what level I stop? Is it just that I follow the recommended treatment for my level, and then I just don't worry?
Good idea. It's a very good question.
What's that?
Yeah, it's a very good question. Yeah. So the thing is, recommended daily allowance for vitamin D is 400 international units. If you feel that you are not taking enough amount of nutritionist diet or something, then you can take 400 IU capsules are available in the market. A good one brand is Swiss brand. It's expensive, but it's good. You can take that 400 IU vitamin D on a daily basis. You can take it, for 2-3 months, and then you can stop like that.
Right. So you take it for
if
2
you are
months
not
and stop, and 2 months and stop. But this 400 IU is a lot safer than the 60,000 international units.
Even 60,000 is 60,000 is also safe in the sense that if you're deficient or insufficient, if you're already if you have normal vitamin D levels and you are taking 60,000, it doesn't make any sense.
Right. So, and I think another question in addition to that is that vitamin D deficiency also causes a deficiency in calcium. This is an actual question coming from Karthik. Again, is this true? And how
yes. So vitamin D helps in calcium metabolism and calcium absorption as well. Right. So that's why nowadays, whenever you take a good brand of calcium tablet, there is always some vitamin D in it. So yes, it's true. So if you will take calcium tablet, there will be some inherent vitamin D in the tablet. Every tablet mostly have it. So you don't have to take anything extra if you have normal vitamin D levels.
Right. And also we're starting to see a few questions, ma'am, which are so in addition to this backache that Vandana was having, we're also seeing a few people who are having cough and cold for a while after the COVID has stopped, and another person who who stopped getting periods, at least during the COVID situation.
It's very common. It's very common. Yeah, it's very common. Don't worry. Any stressful situation in a woman can cause amenorrhea for 1 or 2 cycles. Don't worry about that. If you have, if you have missed period, if you're married, sexually active, you rule out one pregnancy, do one pregnancy test at home. That's a very basic. Everyone does it. If it is not so, then why, Nikhil, you are smiling?
No, I'm just saying that that is actually the right thing to do. You should always check if you're pregnant first before you assume that there's.
This you should do once. Yes, it will change the story completely.
Yeah.
If it is not, then you should be aware that stress, even during exams and all, it's very common to miss your period. So don't worry about it.
Right. And what about these long-term COVID symptoms that a lot of people are having, where they're having the symptoms for a lot longer? Is this normal? Should they be worried about it? Should they be doing anything about it?
Yeah, so basically that's the problem. Since the first wave came in, these long-term symptoms, it's very subjective. Not everybody have it, but some people, these symptoms keep on lingering. Like it's very common for them to say that now my energy levels are not that great when I had earlier in the earlier time before COVID. So these kind of lingering symptoms, if you have, you don't have to worry. By 6 to 9 months time, most of the symptom in most of the people do get away, but it's a long time, 6 months, it's a long time.
Right.
But
I
yes,
don't think, sorry, go ahead.
yeah, please, yeah, I'm done. So it's basically 6 to 9 months is the time. Chronic
Okay.
symptoms, they tend to persist in some people.
But it can sometimes persist beyond that in very rare cases as well, right? Though we should
I have
definitely be doing to check if there's any other reasons,
Yes,
right, that
yes,
this may
yes,
be happening.
definitely, yes.
Okay. And if a person has asthma or COPD, is it good to take some nebulization or even something like Monter LC? This is a question from comes
Yes,
from Payal.
yes. Montier LC is a very good drug. If you have the sore throat and difficulty in breathing because of congestion and all, Montier LC is a good tablet. You can take it for 3 to 5 days, one tablet daily at night. You can even take it morning, evening if the congestion is too high. If you have COPD, asthma, then nebulization will really help. Even in people who have pneumonia, we tend to give them nebulization so as to relieve the congestion. It is really helpful. Even the action of drug, once you nebulize, it opens up the lower respiratory tract and all, and it's easy for the drug to get in, especially for asthma patients.
Right. And I think Vaishali has been really anxious and asking that her mother-in-law, who tested positive about 15 days back from COVID, is currently suffering from acidity. Is it because of COVID in some sense, or
It can be because GI
it can
system
be?
gets affected. Yes.
But is it
So
still good idea to treat this
yes,
this acidity?
if acidity is there, then she can take Digene after 2 teaspoons after meals, after major meals like breakfast, lunch, dinner, or in the morning empty stomach she can take one pantoprazole. If she is hypothyroid, then with thyroid tablet empty stomach, do not immediately take pantoprazole empty stomach in the morning. Have some gap or avoid it. Rather take ranitidine Rantac tablet 150 mg morning evening. That will be better.
Okay, okay. So I think the best treatment is something like pantoprazole, which is a very common medication that all of us give. So if you're taking it, please ensure that you're having it empty stomach first thing in the morning. This is the medicine that you can take. It is for acidity, but any condition like COVID causes acidity as well, right, ma'am? Because of the stress from
Yes.
which it is, it causes an extra amount of acidity. All right, I think we still have over like 100 questions that I'm sure I missed somewhere. I hope we've managed to answer a large number of questions. I'm going to leave you with only one last question, ma'am, which is a PCOS related question. So someone is saying that the PCOS symptoms are very similar to the post-COVID symptoms, like excessive hair fall, irregular periods. How do they decide, is my PCOS getting bad or is my COVID still affecting me? I think that's a very relevant question for users with PCOS.
Yes. See, the first and the foremost thing is, yeah, it's a good question. It's a very interesting aspect.
Yeah, that is actually a
So
very
I'll
good
tell you,
question.
PCOS, diagnosis of PCOS is it's a very complex disease, but it has a very strict criteria. How will you diagnose PCOS? If you are already a diagnosed case of PCOS, then at some point of time you must be knowing that you were having regular periods or not. You were at that time having weight gain or not. You were at that time were having acne, pimples, hair fall or not. If nothing was there, everything was fine, so means your PCOS was under control. Now you had COVID. After COVID, these kind of symptoms start appearing. So so weight gain is one thing that COVID generally is not linked to. But if you are having hair fall, yes, COVID can be the reason. If you are having irregular periods, rather than COVID, it could be your PCOS. So the first thing we should do is to rule out there is not worsening of PCOS or there is not any other hormonal problem if you are having irregular periods, because this is one of the important markers of your hormonal disbalance, not just stress. So stress causing irregular periods will not do it for a very long period of time. It will after 3 4 months, like that. If even after 3 4 cycles you're still having irregular period, then it is a good idea to get yourself checked that whether it is PCOS or thyroid or prolactin or any other problem that is affecting you.
Right. If you're seeing FSH, LH issues, that is more likely to be PCOS than COVID, right?
Yeah, so basically it's a complete hormonal profile, not
Yeah.
just FSH. There are many other hormones we look for.
Of course, of
If
course.
they are deranged, then yes, it is
They
PCOS,
are more
definitely.
indicative of PCOS than COVID.
Yes,
So these
yes,
issues.
yes,
All
yes.
right, all right. So everyone, I'm so sorry. I just saved that last question for Dr. Anjani because she is, after all, an infertility specialist and a gynecologist. So her domain for sure. But I think we'd like to close here, and I'm sorry that we can't take more questions right now because we're
There
really
is one
running.
question. Sorry, Dr.
You take the
Nikhil. There is
last one, don't you?
one question by Dr. Diksha. Diksha
Diksha
Pathak.
Pathak. Yes, yes,
Is
yes.
it miscarriage can happen after post-COVID? In May, I got severe COVID, and recently I miscarriage in my first trimester. Diksha, see, that all depend how much symptomatic you were. If you were really, if you had moderate to severe symptom, then it increases the risk definitely because your immunity is compromised. So yes, if you are in early trimester, in your first trimester, or if you're planning pregnancy and you are pregnant, and you hit COVID, then it's a good idea not to sit at home, immediately visit a doctor, irrespective of your symptom severity. Because we still don't know that how COVID is going to affect pregnancy for sure. Generally, it is seen that most of the, from the, whatever data we are getting from, yes, doctor.
Dr. Anstey, I think the question is a little bit different. I think May last year she got severe COVID and she miscarried very recently. So she's wondering whether the post-COVID symptoms, post-COVID inflammation of the body and the change in the
Post-COVID,
physiological state,
yes.
could that be causing
No.
her
If you have,
miscarriage
yeah.
now,
So
almost 9 months
if
later?
you have, yes, Diksha, if you have recovered from COVID, then it is very unlikely to have miscarriage because of prior COVID affection.
Right. And
So
but miscarriage generally is not such an unusual thing, right? It is not spoken about, but it is quite common
So
in
that's
that
what
sense,
I'm
right?
saying. We don't know yet. The data is the evidence which we have is mostly from Western countries, and it's still not, definitely proven that yes, COVID is not going to have any infection. Although COVID infection is not an indication for termination of pregnancy, nor is the vaccine. If you have vaccinated, if you have recently infected, you can still plan for the pregnancy. You can go with the vaccination. And if you are in early pregnancy, if you are COVID affected, don't think that something happened to the baby. Whatever deliveries have happened, everything was fine till date. But still, we don't have definite, complete, sure data that everything is okay. So we still in a gray zone. Anything can come up, but as of now, things are safe.
Here's a good question, Dr. Anjani. If I was trying to plan for a pregnancy in a month or 2 months, and I want to take the COVID, I mean, rather my fiance or wife, hopefully by the time I start, is considering getting the COVID vaccine or a booster
Go
vaccine.
ahead. Go
Is
ahead.
it okay? Yeah.
Yes, definitely.
All right. Thanks. Just one last question, and I hope this is okay to close, everyone. I know that we've taken not even half of the questions that have been asked. As Dr. Anthony also knows, there were loads of questions from all of you. We will be doing another session with a doctor next week. We'll try to take something more close to the multivitamin issues that a lot of you are bringing up and find someone who maybe has a little bit more experience with that and who can answer those questions. Multivitamins, which vitamin, when to take, and maybe a nutritionist who can give you some great nutritional options to get your vitamins and minerals. Because I think, as you probably agree with me, Dr. Anjani, the natural way is as much the best way as possible, right?
Yes, correct.
All right. So I want to just finish by thanking Dr. Anjani, everyone. Dr. Anjani, who is spent a whole hour trying to discuss how to take, great self-medication, which is something that we encourage. We encourage you to take care of yourselves, but to always seek out support when you're not sure. And we really had a lot more we would have loved to do about the sources that you can use to decide these kinds of things. But we'll see if we can just submit that or publish that somewhere on our Instagram or something when we're looking at great sources. One thing I think Dr. Anjani and you and me agreed was the NHS website is a brilliant website to really look up diseases, look up drugs, look up what to do in certain situations. Very simple, easy language, right?
So yeah, there is NHS website. There are patient information leaflets which are dispensed by American societies, UK societies. All that you can easily avail on internet. It is very written in simple language for you to understand, rather than going for random blogs and YouTube videos and googling it and getting half baked knowledge and then having your own conclusion and then mismanaging. Don't go for that. Rather have a authentic source. Authentic source are generally government organizations which are proven, like WHO is one, NHS is one, RCOG is one, NICE is one. American guidelines are coming up, and they all of them, most of them, write in a patient-friendly manner, in a very simple language for you to understand. So you can, always go with that.
This is our last attempt to give you some information sources because we need to leave and we can't always be available to you. But we hope that you're able to access these sources and utilize them to the best of your ability. So thank you very much. Thank you, Dr. Anjali, for coming. Thank you all of you for joining and staying with us and providing such amazing, insightful questions. We really, really did enjoy the session, and we hope that we can see you again soon. I'm sure to bring back Dr. Anjali again. Maybe there'll be a whole host of gynecological questions the next time you come, ma'am. But thank you so much for joining this session.
Thank you, Dr. Nikhil. Thank you, everyone. It was a privilege to be here. Thank you so much.
Thank you.
Okay.
See you,
Bye.